Hey everyone, good day to all. Today in this video, I'm going to complete all the important poisonings related to the only exam based on the for the only exam purpose. Okay, so how they are going to ask the questions here. Today I'm going to explain all the important poisonings. Okay, so let's go start. So I'm going to record the session so you can view it in YouTube session. Okay, done. So myself, the agent mode. I think you know about me. So the first one is yes, it is the lead poisoning. It is a lead poisoning. Okay. Remember here, remember here, first one the lead poisoning here. Guys, okay, done wait. Okay, done. See, in the lead poisoning, guys, what are the important points you have to remember? What are the important points you have to remember? It's they will give the image in the exam. Okay, this is the workout. This is called as button. This is called as what? This is called a Button's line. Okay, this is called a Button's line. What is called Button's line on gums, and also you can see this. Here is the basophilic. What is basophilic stippling? The basophilic stippling. We can see the basophilic stipplings here. Okay, so these are the two very important one. Okay, these are two very important topics, two important points here in the lead poisoning you have to know. Okay, so this is the so happening here chart array. Okay, so what are the important points here? It is see here this is the buttons lines on the gums and what there is a basophilic stipplings. Okay, there are 2 points you have to remember about the lead poisoning. Okay, this is the mnemonic is the lead. Lead means lead line, that is buttons line on dense bones if for encephalopathy or erythrocytic basophilic stippling. And there is a anemia. What type of anemia? Microcytic. It is the microcytic. Okay, now microcytic and hyperchromic anemia. And there is a D for what? There is a neurotoxicity. These two wheast or foot drop. Okay, and also there is a GI distress. That's called as lead colic. Okay, they are the important about the lead poisoning. Okay, treatment we will see. Okay, in the upcoming slides. Treatment we will see here. What you have to give? Serious therapy, EDTA, BL, or you can give the DMSA. Okay, you have to remember about the lead poisoning. Okay, remember these 2 points: button line and the basal stippling. And next one is guys about the thallium poisoning. Actually, thallium poisoning is asked in the exam in the Neet PG, Initiate, and also in the Fmge also. Thus, they will see guys in the thallium guys. You have to remember only these points: alopecia, madarosis, skin rash, and painful peripheral neuropathy and confusion. They will give this same image. That the same image, okay, that is the what? Alopecia. That is the thallium. Thallium induced alopecia. You know, thallium induced alopecia. And there is what is madarosis means? There is a what? There is absence of what? Absence of eyebrows, eyelashes. Okay, absence of eyelashes. That's called madarosis, skin rashes, painful peripheral neuropathy, and confusion. These are very important points about the thallium poisoning. Okay, so these are the important. You have to remember the first point only. Okay, so what is the antidote? It is the Prussian blue chelation. So what are potassium ferrohexacyanoferrate. Remember, this is thallium means tala. It's a tala. Talakai. Tala means what? It is a head. This is alopecia. Done. Okay, very good. Next one. Next is called it is cannabis. It is called ganja. Ganja in Hindi. Okay. See, this is what you have to remember in the cannabis. It is called as run amok. It's called as what? Run amok. It's also called a killing spree. Okay, na? If you take this one, the person who take this one, he's going to kill everyone. Okay, he's going to kill everyone. It's called run amok. He's going to kill everyone who are whoever coming uh, towards him. He will just okay, I'll kill you. I will kill you. Champasta. मार डालूंगा साले. It's like this one, okay? It's a run amok killing spree. It is a motivation, always a motivation. Okay, see, and also everything, heart rate is going to increase, respiratory rate is going to increase, there is a more hunger, there is a more appetite. Okay, remember this one. The eye is going to congested. This is the what? This is the most widely. This is the most widely used. Okay, drug. It is the most widely abused, being abused. Okay, nowadays this cultivation is this nowadays this cultivation is almost restricted by the law. Okay, remember the active principle is the DTHCG tetrahydrocannabinol. Okay, it is what shape? This is the burnt burnt rope smell. The burnt rope smell. Remember here there are the forms of the cannabis. They are the charas or hasis, marijuana, bhang, and there is ganja. Remember, okay, from what the marijuana obtained from what? Dried flowers. Bhang from leaves. That's you have to remember this one. And also guys remember here. See whatever I mark in the red one, okay. Whatever I mark in the red one is very important. Remember cannabis, very important one is run amok, killing spree, a motivation. All signs are increased. Most commonly abused substance it is the cannabis. You have to remember treatment, guys. You have to remember treatment is the what you have to give this one, guys. This one, the treatment. So mostly they're going to give the history. Okay, person is like a run amok, a motivation, everything they're going to mention. Okay, so next one, guys, Dhatura. I think everyone knows what Dhatura. Dhatura. Okay, Dhatura is also called as what? Also called as railway or roadside poisoning. How they are going to ask this question is that they will ask like this one. A person is going towards the railway, like a person is going towards and he ate something roadside. Okay, something from the roadside or else railway side. Okay, it means he's mentioning about the Tura. You guys are thinking, what roadside, everything is there now. Huh? And how come? Yes, it is also called what? Also called as roadside is roadside poison. Also called as railway side poison. Remember this one. What is the active principle? It is the hyoscine and atropine. What is the scientific name of Dhatura? Atropa belladonna. Okay, Atropa belladonna. Atropa means what? Atropine. Okay, na? Atropine is a anticholinergic drug. Okay, hyoscine. Hyoscine used in treatment of what? Treatment of motion sickness. Hyoscine is treatment of motion sickness. Okay, na? There is a C. Remember the 15 D's. Signs. This is a decrease. See, all DDD. Decrease muscle contraction, delirium, delusion, dermatitis, dilated pupil, dreadful hallucination, drowsiness, drunken gait, dry hot skin. See, all are D, 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 D. Remember Dhatura, D, 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 D. Okay? Remember the signs here. Or the antidote, the antidote is a physiostigmine. It is a physiostigmine. Physiostigmine is the antidote. If they ask you, what is the antidote for the atropine? Physiostigmine only. Okay? Done. Next one is, guys, coming to the amphetamine. Okay, remember here, amphetamine, they will give the history as that one. There is a increase. What is increased psychosis? Increased psychosis. What is the increased psychosis? Seizure, the seizure, increased suicidal thoughts, urine liquid gold. Urine liquid gold. It's called as urine liquid gold because you know what? Amphetamines. See, amphetamine is going to unchanged in urine. Amphetamines is unchanged in urine. Suppose I am the thief, I want to I want to bring amphetamine to India. Okay, to India. So I will drink the amphetamine. I will drink the amphetamine because amphetamine remains in the urine for the longer time. So I will just reach to India. After reaching to India, I will just urinate over that one and just extract the amphetamine. It's called as what? Urine liquid gold. Let's remember this here. Here, body packers and stuffers. They will give the history as like this one. Increased psychosis. There is a what? A suicidal thoughts. Urine, liquid, cold. They will mention this one. Okay. Remember this one. Also remember a body packer. You have to mark the answer as the amphetamine. Okay. So next one is the opium. Okay. What is the triad of opium? But the triad of opium, it is the meiosis. What is meiosis? Pupil constricted. Okay. There's a respiratory depression, coma. These are the triad of opium poisoning. Okay. Opium is called as Afim in Hindi. Okay. Afim. So opium triad is the meiosis, respiratory depression, and coma. Remember here, in opium, all vitals will be down. Okay. All vitals will be down. Okay. But what here? Where? In cannabis, all are increased. Remember that one. Opium. Okay. Next, if they ask you what are the symptoms of opium withdrawal, okay, see these are rhinorrhea, diarrhea, yawning, and salivation. They are the opium withdrawal symptoms. Okay, remember, if they ask you what is the triad for the opium, meiosis, respiratory depression, coma. Okay, opium withdrawal, rhinorrhea, diarrhea, yawning, salivation. Remember like this one. Okay, the next one is the cocaine. Is the cocaine. Remember here, okay, they will mention the particular science here. Okay, it is the acute and the chronic. Okay, they're going to always ask you guys about this. This is called as what? In chronic, we see the symptoms as cocaine bugs. Means what? They also called as formication. Also called as formication, because here in this type of patient, they will feel that something is running over here. Some insect is running over here, but there is nothing. Cocaine bugs, they will feel that, okay, something. This one is the cocaine bug, also called as Magnus syndrome. Okay, they will give the history. A patient feels like the tactile hallucination. It is the case of cocaine. Okay, then nasal, there is a incontinence. There is a nasal septal perforation. Treatment is the amyl nitrate. Next one. Remember here, it is the next one is the LSD, that is called as lysergic acid diethylamide. Ethylamide. Okay. See here, guys. What you have to remember here in the LSD, guys. Remember here. Only remember here. There is a reflex. There is a reflex hallucination, and patients seeing red colors while listening to the FM radio. Here, it means here. Remember, see here. Here. See here. Where is that? Okay. Okay. Here the patient will be seeing smell. Anyone can see the smell. No, we can smell now. We can't see the smell, but this patient, they will smell the smell. Okay. And hearing colors occur. Oh my goodness. Did you hear the colors? No. But they see what this is called as what? What? It's called a trekking tip. It's called as taking trip hallucination. Taking trip hallucination. Okay, na? See, this is patients. These are the important points they are going to mention in the exam. Patients seeing red colors while listening to the FM radio. There's a flashback phenomenon. There is a taking trip hallucination. And also, individual become violent or panic stricken, and he may attacks urge to kill, or he will hurt himself. Treatment will be low dose anti-anxiety drugs, benzodiazepines such as diazepam 10 to 20 mg, or you can do the psychotherapy. Remember here, this is the strychnine poisoning. What you have to remember from the strychnine is remember here the strychnine poisoning, it resemble to what? It resemble to tetanus. Okay. Strychnine poison is resemble to what? Resemble to tetanus. This is the important one. Okay. Remember the important symptoms here. Remember here, this is the opisthotonus. This is the opisthotonus. This is the opisthotonus position here. This is the rhizus sardonicus position. Okay, so one thing remember here, it is resemble to what? Tetanus. Okay, and we can also in severe convulsions, you can see the opisthotonus positions and rhizus sardonicus position. Okay, so remember here, what is the main difference between the strychnine and the tetanus? Remember, see here, there is a relaxation between the fits in quite complete. Okay, there is a relaxation, but there is a see, but there is something relaxation, but in tetanus there is no relaxation, never quite. An important one. Tetanus to strychnine poisoning. Remember, these are the important one. Remember, next is the arsenic poisoning, guys. Arsenic poisoning. Remember this one. This is the very important one. This is the what is called raindrop. Raindrop pigmentation of palms and hands in the case of the chronic arsenic poisoning. Okay, this is the important. Raindrop is important. Okay, now there is a hyperkeratosis of palm and sole. These two features are very important. And also remember, guys, arsenic poisoning are always similar with the cholera. Arsenic poisons are always similar with the cholera. Then how we are going to differentiate between the either it is arsenic or cholera? Okay, just read this one. Read this one, guys. Please read this one. Okay, so that please try to differentiate between the arsenic poisoning and the cholera because almost there is the same symptoms of the symptoms are going to be similar the arsenic and the cholera. Okay, just remember this one, guys. Guys, this one I took from the Dr. Narana Reddy this one for FMT forensic medicine and toxicology. So just remember what are the antidotes. Okay, some important antidotes. You can remember this one. At least this you have to remember. And this one, guys, remember here in the acute. Remember here in the acute iron poisoning. Okay, in the acute iron poisoning, it is the deferoxamine. It is the deferoxamine. In the chronic what? In the chronic, sorry, in the chronic poisoning, you have to give what? You have to give the defiprion. Okay, these are the important one. Please master this one. Please master this one. And thank you very much, guys. See you are from this, guys. I'm expecting one MCQ. Okay, one MCQ will be sure for that one in the examination. Okay, just master this poisoning. Just try to write in your words. Which I am just while I'm preparing for the Fmge examination, I just prepared, and from there only I'm writing everything in the for the PPT purpose. Okay, so please master these poisonings. Okay, tomorrow I will keep I'm going to post this video in the group as well. Okay, thank you very much. Please study hard.